The objectives of today's session: sphenoid dysfunctions and cranial osteomanual therapy. First and foremost, physiological versus pathological dysfunctions. And the next one, sphenoid is part of the median and the inferior osteokinetic chain. So it will influence the ethmoid first. And next, of course, it can go in either direction to vomer. More inferiorly, it's only the single bone which is dependent on sphenoid. And then more it comes via the ethmoid, it can come to the front and to the frontal. So that is the reason the techniques are directed to frontal and access to the sphenoid through the maxilla or the palate. Okay. So from the palate, if I have to show you where the palatine bone is, remember that the maxilla, you're going here and you get that step. This is the palate. Okay. So last teeth you are there, just to come medially, that is the palatal bone. Okay. So, right. So you have got here with one finger on the palate. Okay. And you have stabilized that. And here the sphenoid. Okay. So here sphenoid is there, greater wing. Okay. So here the palate, one finger is there. Here sphenoid, greater wing, outside I am there. So position is, he is supine. So I am holding like this. Okay. And I am giving a distraction. Okay. So this is the actual thing that we are trying to achieve. Okay. Together with the inhalation. Okay. So greater wing, index, and sphenoid. This is the palate. Okay. So here. Okay. So the same way you see that sphenoid versus zygomatic. So you can go for the greater wing and then hold the zygomatic and give the forces. Okay. For the sphenozygomatic. Okay. So that is also possible. And of course, ethmoid, I told you that block the sphenoid. Sorry, sphenoid fell down. Okay. Just hold on. So sphenoid with the ethmoid. Okay. Ethmoid. Okay, ethmoid. And goes into the nose, the space here, ethmoid. Okay. So again. Okay, keep it opposite. Okay. So now it is correctly aligned. So, right. So goes inside the nose and then fixed to the frontal. Okay. So here again, ethmoid you want to influence, which is deep inside below the frontal. So here one is on the greater wing. Other hand is on the frontal plus lacrimal. So ethmoid is here inside. Okay. So you hold like this and you can influence the sphenoethmoidal indirectly. Okay. And so sphenoidal sinus, where the mechanics is going to describe in the slide, involves the vomer and the sphenoid movement. Okay. So it's either a flexion of the sphenoid with the extension of the vomer, it's called as. So you need to be careful in understanding this mechanics. So this vomer is there. This is sphenoid lateral view. So if sphenoid is flexing, vomer flexion is this, going closer to the sphenoid. So it is like humerus and radius ulna. Either radius ulna goes towards the humerus or humerus comes towards the radius and the ulna. Both are flexion only. So spheno, I will prefer to use the term sphenovomeral flexion. Okay. I will not use the term The flexion of sphenoid, flexion of vomer. Okay. So what we have here is the vomer, okay, which is connected to the middle here in this one here. Okay. So vomer can rotate, vomer can flex and extend. Okay. Vomer can also bend. Okay, because it is partly cartilaginous. So now sphenoid flexion in sphenobasilar flexion. Okay. Vomer flexion, sphenovomeral flexion. Okay. So either sphenoid flexes or vomer flexes. So that is like that. So don't think of vomer flexion as coming down. It is up. Okay. The posterior portion is down, anterior portion is going up in the vomer. Okay. So these rotational movements of the vomer with the sphenoid, the rotations can be in the same direction you can facilitate, or the rotations can be in opposite directions. So when you are doing it in opposite directions, it will influence the sinus. Where is the sinus? The sphenoid body has the sinus. Okay, inside the body, the cavity is there, sinus. Okay, so the spaces. Okay, so to open and close the sinus. So what do we actually do? Easiest to remember that extension of sphenoid with the exhalation closes the sinus. Okay, and the other one, which is flexion, which is actually opening the sinus. So this is for sphenoid. Sphenoid extension means sphenoid comes like this. So what happens to the vomer? Okay, vomer will flex. If sphenoid extension is superior, okay, pardon me, sphenoid extension is this, okay, superior. Sphenoid flexion is downwards. Sphenoid extension, vomer extension. Okay, so this is what is happening. Sphenovomeral extension. Okay, so vomer also extending. So now we are going to see that for that, the technique is performed in 3 cycles. One which is opening and closing the sinus. You might give pressure on the palate because this vomer is going inside the nose. Okay, and you can see here that anteriorly in the nose, in the middle, the vomer is there. Okay, so the orange one here. Okay, where the tip I am touching. So I can influence the vomer by giving pressure on the midline between the maxilla. Okay, so I can give the pressure on the vomer, and other hand can give the pressure on the greater wing. Okay, so then what happens? Here vomer is given pressure, here sphenoid is given pressure. So I can rotate the sphenoid, I can rotate the vomer, both in either of the directions. Okay, so that is how that's vomer pump technique or sphenoidal spine sinus technique is done. The second phase of the technique involves synchronizing with the breathing, and third one is more of the cooling down phase, where you are just leaving and you are just assessing. Okay, so that is the 3 phases of the sphenoidal sinus release or / vomer pump technique. Okay, so